I'm going to tell you about a medical specialty most people have never heard of, and it might completely change how you think about treatment. It's called Interventional Radiology. Instead of treating disease with large incisions and open surgery, we used advanced imaging to guide tiny catheters, sometimes smaller than a piece of spaghetti, right to the problem or right to the source of the problem. We can shrink fibroids, treat an enlarged prostate, open blocked arteries, and calm an arthritic knee, all through a tiny pinhole in the skin. For a lot of people, that means avoiding major surgery, less pain, and getting back to their life in days instead of weeks. So if you've never heard of interventional radiology, you're not alone, but our procedures may be an ideal option for you. If you're looking for a less invasive option, let's find out together if we can help you. What if surgery wasn't your only option? For a lot of the patients I see, it isn't. People come to me having been told they need surgery for fibroids, an enlarged prostate, knee pain, and more. And often, after we look at the imaging together, I get to tell them something they weren't expecting. There may be a minimally invasive option, one that treats the problem through a tiny catheter instead of a large incision, easing the symptoms while you keep the organ, skip the long recovery, and go home the same day. You won't know until you ask, and the first step is simply finding out whether you're a candidate. Call Vascular and Interventional Specialists of Alabama, and let's find out together before you commit to surgery.